Welcome to the Newark Regional Business Partnerships Engage and Exchange podcast. Join us for business insights and meaningful conversations with NRBP's member organizations. Thank you to our podcast host sponsor, the Martin Tuchman School of Management at NJIT. Additional support for NRBP's Engage and Exchange podcast is provided by PSEG and LISC New Jersey. Hello, I'm Ferlanda Fox-Mixon, President and CEO of the Newark Regional Business Partnership. We are the premier chamber of commerce serving the greater Newark region. Our guest today is Maybelle Lincoln, co-founder and communications director of Pathways to Trust.
Welcome.
Welcome, Maybelle.
Thank you
for joining us today.
Thank you so much for having me.
So we're going to first start off by finding out a little bit about you before we start talking about Pathways to Trust. So tell us a little bit about you.
Well, I started my career as a high school teacher, but I then went into advertising, copywriting. I was a pharmaceutical copywriter. I did some medical copywriting. And when I was off work having my first child, I was recruited to be part of a physician training program that used actors because I had a background in acting. So I became part of this program that taught doctors and nurses compassionate communication, that when they had to break bad news. Well, I did that for a while, and that's where I met my current business partner, and we decided to form a nonprofit that didn't just focus on teaching physicians how to communicate, but make sure to be very concerned about the patient's point of view and the patient's goals. So in addition to that, I am a wife of 20 years and I have 2 children.
Oh, wonderful. So the name of your partner, who's your partner?
My partner is Cheryl Lloyd.
Okay, very good. And now is Pathways to Trust, is that the nonprofit that the two of you formed together?
Yes.
So tell us about that organization.
So we had worked together on the physician training. And as time went on, we realized that all the focus was on how the doctor could feel more comfortable when he or she was breaking bad news to patients. And that's great. And it was a successful program, but there wasn't a lot of focus on how the patients felt and what their goals of care were. Because doctors sometimes don't understand what the patient really wants, especially in cases of chronic disease, in cases of life-changing bad news. They may have different goals of care. So we decided that the patient's voice needed to be amplified. And then where do we start? So we decided that the patients who really needed their voice amplified were rare disease patients. And then from there, we said, well, which of the 10,000 rare diseases do we start with? And we chose sickle cell disease because sickle cell patients face a triple barrier. First of all, they're a rare disease, so there's not a lot of information. Second of all, there's the racial bias in healthcare because sickle cell is predominantly a disease of African Americans and secondarily Latin people. And the third problem is in the wake of the opioid crisis, people who are appropriately treated with opioids can't get relief. So we chose them.
Okay, very good. So when you talk about rare diseases, do you have a definition of what constitutes a rare disease?
Yeah, a rare disease, I think it's the CDC's definition, is under 200,000 people affected in the United States. The largest rare disease is sickle cell, but there are many other rare diseases that come in with a large amount of people. And we serve all rare disease, like in our Reimagining Pain Through Art program, anyone can join. But our 2 focuses, in addition to sickle cell, our other one is connective tissue disorders. Those are painful disorders that also incapacitate people and have a similar lack of belief amongst the medical community. That's the connecting thread between sickle cell and connective tissue.
Okay, very good. So how large is your constituency? How many people do you serve?
Well, we serve both professionals and patients. So we have trained probably about 500 medical professionals, and that includes students. We like to start with medical students, nursing students, and get them when they're still enthusiastic. And we've done a lot with them. And as far as patients, the Newark area has approximately 450 sickle cell active seeking treatment patients. And we branch out to all of New Jersey. So, and we're also branching into the Latin community as well. So we serve probably about, in total, 2,000 to 3,000 people.
That's impressive. And are you based in Newark?
So we do a lot of work in Newark. We are actually based in Mendham because we decided to start this during the pandemic. So had to be based in our homes.
I understand. So talk about some of the programs and initiatives that you have.
Okay, so our first program was Time to Listen.
Okay.
Because our point was that it was time for medical professionals to listen to rare disease patients. And as I said, we began with sickle cell, so our first subgroup of the Time to Listen program was Time to Listen to sickle cell disease. And it is, as I said, two-pronged. We explain and engage with professionals and healthcare professional students so that they can understand what I call the 360-degree experience of being a sickle cell patient. Obviously, we have a medical professional teaching them the medical stuff, but any chronic disease, and sickle cell in particular, is impacted by so many other things and impacts so many other things. There are emotional and psychological effects of this disease. It influences your social development, children who miss school, impacts their education. Adults, it impacts their ability to hold a job because it's a volatile condition. They never know when they're going to be laid up for weeks. That affects finances. And all these things that sickle cell affects then come around again and affect the trajectory of the disease. Because if you're financially hard up, it's difficult to get treatment, et cetera. So we explain that to the professionals, and the patients, we help them become empowered and help them manage some of these aspects of the disease.
Are these sessions where you have the professionals and the patients together, or you do them separately?
Well, we never don't have patients because all of our programs are developed and delivered by the patients themselves. So when we have professionals, we have a thought leader who gives them the medical stuff, but we always have a patient advocate who gives their personal story and gives advice on what you need to bear in mind treating sickle cell disease. But then for patients, we also have separate programs, and often we'll have a medical professional there. For example, we had we have a financial program that's part of this, and so we'll have a doctor there talking about the impact of your health on work. So it's somewhat mixed.
And then I believe you also have a program where you're doing like healing through arts.
Yes.
You want to talk about that one?
Yes, we have a program that's called Reimagining Pain Through Art, and it is an art exhibit. It's a traveling art exhibit that features art created by rare disease patients who experience chronic pain. And these people create either visual arts like drawing or paintings, in some cases sculpture, that celebrates their resiliency and explains their pain as well. And some of them create literary works, essays, short stories, and a lot of poetry.
Okay, very good. So what are some challenges that your organization faces in trying to further its mission?
Well, as with most nonprofit organizations, the foundation of all our challenges is funding.
Okay.
Trying to get enough funding to bring our programs to as many places as possible.
Okay. And so if someone wanted to make a contribution to your organization, do you have a website?
We do. Pathwaystotrust.org. They can contribute there. Thank you.
And so talk about some of your triumphs.
Well, the time to listen to sickle cell disease has been a huge triumph. The professionals who go through it really say that their opinions have changed a great deal about how to treat patients and just their understanding. Like, I remember one nursing program that we did. It was hybrid, so we were in the room with some nurses and there were some people that were virtually attending. And when it was over, I overheard some of the nurses speaking. And these are people that had treated many sickle cell patients. And one woman said, I don't understand. How can they keep a job? If they have all these hate crises and they last for so long, how do they manage to survive? And like, this was a new revelation. And at that moment, I'm like, yes, that is what we've been trying to achieve, to just understand where these people are coming from and all the things you knew to address.
Mm-hmm. And what about the outreach? Like, how are you promoting and marketing the organization? How do you get people to come and really benefit from the services that you provide?
So if it's a patient program, we are partnered with many community-based organizations. Right in Newark is SCANJA, the Sickle Cell Association of New Jersey, that's Mary Lamar. So she will promote to her mailing list. There is many other ones. Donna C. Darian is also in Newark. And some of our programs that are larger in scope, the Crescent Foundation is down toward Philadelphia, so we'll market to other CBOs, but we also go to places where the patients are treated. The Newark Beth Israel Sickle Cell Center, University Hospital, Overlook also treats many people, so that's how we market.
Okay, and then do you have a staff? How large, if you have one?
Our full-time staff is Cheryl and I. Everyone else is a contractor. So we have many contractors, but only 2 full-time.
Great. So now talk to us about NRBP. So why did you decide to become a member of the Newark Regional Business Partnership?
We do a lot of our business in Newark because Newark Beth Israel is the hospital that treats the largest number of sickle cell patients in the state. And it just made sense to us to be part of the community that we're serving. It's an opportunity for partnerships to serve the patients that we serve and the professionals. For example, when we're doing a patient-facing program, we can partner with businesses to offer incentives to the patients. And that gives the business a chance to have some face time and show their support of the community. And it gives us something to give to the patients because these people are coming out maybe when they're not feeling well. So we like to respect their time by giving them something. We get to learn about how vital Newark is. We got involved with the Arts Council here, and that has given us such a great outlet to share reimagining pain through art and bring in so many more artists and public and have the community learn about how they can support sickle cell patients.
Well, great. Is there anything else you'd like to share before we close it out for the day?
Just that we're so happy to be in Newark. I was born in Newark, and my family has been from Newark for generations. And so we're so happy to be here and to be able to serve this community and be part of this community. And thank you for allowing us to be part of the business environment and community of Newark Regional Business Partnership.
Well, thank you for joining us today. Thank you for sharing your story. And we wish you all the best.
Thank you so much.
Thank you. Thank you for joining us today. As always, I'd like to leave you with a quote. Your attitude, not your aptitude, will determine your altitude. And that's from sales guru Zig Ziglar. Thanks again for joining us. Thank you for listening to NRBP's Engage in Exchange podcast. Tune in next time for more NRBP member organization insights. For more information about our organization, visit www.newarkrbp.org. Thank you again to our podcast host sponsor, the Martin Tuchman School of Management at NJIT. Additional support for NRBP's Engage in Exchange podcast is provided by PSEG and LISC New Jersey.